So the evidence as it relates to low-calorie sweeteners and body weight is debated and a source of controversy. There's some concerns that low-calorie sweeteners may not have the intended benefit, which is to say induce or help manage weight or lead to weight loss, but may have the opposite effect. One has to look very carefully at the evidence to really understand where that signal is coming from and understand what the true effect and the true associations are. So if one invokes an evidence-based framework and looks at the highest level of evidence that we have from prospective cohort studies, these are observational studies where we cannot infer causation because they are at risk of residual confounding, but give us assessments, certainly reasonable assessments of the exposure to low-calorie sweeteners and ability to adjust and then look at weight. And if one looks at even higher level evidence from randomized controlled trials, these trials allow us then to infer causation because they allow for the randomization of confounders between test and control groups. If we look carefully at that, we actually see a very different, and we look at it in terms of the intended substitution with sugars to displace excess calories from sugars, in particular sugar-sweetened beverages, then we do see the intended benefits. So if we start first with the prospective cohort studies and we look carefully at that evidence, and we've looked very carefully at it and critiqued it and are in the process of putting together reviews on that, what we see is that the association that has been discussed in terms of this increase in weight really relates to something called reverse causality. It's the most likely explanation. It's certainly the explanation that's given by the authors of the individual studies that have looked at this and those that have systematically reviewed it and the guidelines committees that have reviewed it. Where this is coming from and what this really means is that people that are consuming low-calorie sweetened beverages are doing it as a strategy to lose weight. So they're at risk of actually gaining weight, and therefore you're more likely to see weight gain in this group. And you can't separate that very well from the low-calorie sweetener effect, if you like, underlying it. So this is something called reverse causality. If you're able to manage that better, and there are ways of doing that epidemiologically, and very careful investigators have done that by doing things such as adjusting for adiposity, which gets at this at risk for weight, measuring change in consumption as opposed to baseline or prevalent consumption, and looking at the intended substitution, which I think is very important in this, which is displacing calories from something like a sugar-sweetened beverage. If you look at it in each of those cases, what you actually see is the opposite. You do not see an adverse association. You see no association or even a benefit. If we look at higher levels of evidence then from randomized controlled trials that give us better protection against bias, you actually see the benefit more clearly. So in these particular studies, and I think again stressing, looking at those at the intended substitution where you're displacing calories from sugar-sweetened beverages, what one sees is the intended benefit. One sees weight loss, and one sees the attendant cardiometabolic benefits that come with that: improvements in blood sugar, improvements in blood pressure, and to some extent maybe some improvements in lipids. We've done some very careful network meta-analyses looking at that question and have shown that. And in particular, when we look at the comparison with water, which is the gold standard, if you like, for replacing sugar-sweetened beverages, we see that it behaves no differently. So you're getting the same intended benefit that you would get from water. And overall, when we put this evidence together, I think we can say with some confidence that there is the intended benefit that one would expect if you're displacing calories. I do think we need more research, although I think that we have confidence in being able to recommend them, in particular as it relates to the intended substitution, displacing excess calories from sugar-sweetened beverages. I think we do need more research to answer some of the uncertainties that have arisen out of the guidelines processes reviewing the evidence. In particular, as it relates to the epidemiology, so our prospective cohort studies, our observational evidence, I think we need more analyses of the prospective cohort studies that have deal and help manage the reverse causality question a little bit more. So looking at adjustments for adiposity, measuring and modeling change in intake as opposed to baseline or prevalent intake, and look at the intended substitution, which is to displace excess calories from sugar-sweetened beverages. So that's the epidemiology, and I think we need more work there. In terms of randomized trials, I think we do need more large randomized trials. This is the gold standard of evidence, considered highest quality of evidence, and I think we need studies that are not of the variety that have been more short to medium term, but actually more long-term studies. The longest study to date is 18 months. I think we need more studies like that. That's in children. We need studies like that in adults, even 18 months to 2 years, to really, I think, address some of these uncertainties and put a lot of these questions aside.